Conception, as defined in Webster's Dictionary, is the process of becoming pregnant through fertilization or implantation, or even both. Some people define conception on an emotional level as starting a family, or even hell, having children as a miracle or a gift. In fact, in the United States, approximately 4 million little miracles are born per year. And of these 4 million precious babies, about 51.2% are girls and 48.8% are boys, all new members to our growing world. But where do babies come from? The Cabbage Patch, the stork, a watermelon seed? While many of us have heard tons of places where babies come from, we all know the so-called truth. So I'm going to spare you some of the more in-depth details. Anyway, once the deed is done, sperm travels up into the cervix and into the uterus, and if the egg is present, it may fertilize it. This is the most obvious and ideal way to conceive. But to some women, becoming pregnant isn't as particularly easy as it sounds. In fact, many women experience many problems when wishing to become parents, because there are many things that could go wrong. One common cause of infertility in about 40% of infertile women is blocked fallopian tubes. But first, what is a fallopian tube? A fallopian tube is the two thin tubes on both sides of a woman's uterus, and their job is to lead the mature egg from the ovaries to the uterus, allowing it to be fertilized. A blocked fallopian tube is any obstruction that prevents the egg from traveling, allowing the egg to get fertilized. A blocked fallopian tube can occur in one tube or both tubes. And this picture shows the three main areas where a fallopian tube could be blocked: your proximal, your mid-segment, and your distal. So what are the options for women with blocked fallopian tubes? A solution came in Great Britain when doctors were doing an experimental in vitro or in-glass fertilization procedure. The doctors responsible were a gynecologist named Patrick Stipo and a psychologist named Robert Edwards. These men had been working since 1966 to find a solution for infertile women to have babies. Many early attempts for this experimental procedures were failures, but they did, however, find success in being able to fertilize the egg outside a woman's body. The problem came when placing the now fertilized egg back into the woman's uterus. In 1977, every attempt to place the now fertilized egg back into the woman's uterus had failed, and the pregnancy had only lasted a few short weeks. Success, however, did come with a woman named Leslie Brown. Miss Brown was monitored throughout her whole pregnancy, and much to the delight of everyone, everything was perfectly normal, and her baby, Louise Joy Brown, was born without any complications in July of 1978. Here is Louise Brown, the test tube baby, standing next to her mother and her father, Leslie and Robert Brown, and she's holding her son, Cameron. Louise Joy Brown turned 35 in 2013, and her life is completely normal. Because of this success story, IVF, or in vitro fertilization procedure, is now performed successfully all over the world, and is so common that more than 5 million women have conceived babies through IVF. When this experimental procedure became a success, IVF allowed fertile women's dreams of having their own little precious miracle a reality. Thank you.